Well, with coronavirus cases spiking here in Florida, many Bay Area hospitals are dealing with an influx of new patients, and many intensive care units are nearing or they're already at capacity. Joining us now is Dr. Jason Wilson. He's Associate Medical Director of the Adult Emergency Department at Tampa General Hospital. Joins us again. Good morning, Doctor. How are you?
Hey, good morning. Glad to be here again.
Well, get us up to speed on how things are at TGH. What are you seeing there?
Sure. So we continue to have much higher volumes of COVID patients than we were seeing in March, April, May, and the early part of June. We were able to prepare for that volume, so we still have been able to increase capacity in both our ICU spaces and also our COVID spaces, where we really kind of protect people who don't have COVID from being around the patients who do have COVID, so we can keep the hospital running safely as well. But still really seeing volumes 3 to 4 times higher than what we were seeing in the spring.
Are you anywhere near capacity? Does that concern you at this point?
So we had the lead time, the spring to get ready. We saw what happened in New York City, and we were not in New York City, and we're still not in New York City. We have case fatality rates that are much lower. The number of deaths are way, way lower, but it gave us time to prepare. And so we were able to convert spaces to ICU spaces, and we still continue to convert other spaces. So by continuously kind of recreating space, we're able to keep up with the demand, and then also trying to create as much virtual space as possible, meaning working with our COVID clinic as outpatients and trying to get those people home safely whenever possible using telemedicine.
One of the things we've been hearing about is a shortage of some of the drugs that are being used to treat. Remdesivir, I guess, is one of them. Are you experiencing anything like that there?
So there's 3 basic treatment modalities right now that we are concerned with supply: remdesivir, dexamethasone, and convalescent plasma.
Yeah.
So remdesivir is the drug that was a pharmaceutical drug that got emergency use authorization. There is more of that drug coming to the state as of last week, so that's a good sign. So our sickest patients, we have been able to get the remdesivir for when we need it right now. So it's sort of a just-in-time supply. Dexamethasone is an old steroid medication, been around for a long time, inexpensive old steroid medication, but it's got some of the strongest clinical evidence that patients who are on oxygen may benefit from that drug. And so, of course, that's driving up the demand for that medication. And so what we're doing right now, Russell, is we're shifting that steroid only to COVID patients, then utilizing other steroid medications in other patient situations. With plasma, I would say to the viewers and to anybody else who's recovered from COVID, this is where we could really use some help. If you've had COVID and recovered, you can donate plasma, and we can utilize that plasma to really save patients' lives right now. You can save up to 3 lives potentially by 1 donation.
Dr. Wilson, I don't want to stick you in the middle of a controversy, but I do want to ask a question about kids, children, and transmitting the disease, because there's so many questions right now about whether or not we should start schools, in-person schools, keep them virtual, what we should do. Clear it up, but do clear up for us what we know so far. Can kids transmit the disease among themselves? Can they get it? How severe is it? And can they transmit it to their parents at home?
Yeah, these are all good questions. And look, I'm right there with most of the parents in this area. I had to turn in a letter last night to our school district that stated where my middle schooler was going to do on the delayed start date of August 24th now. This is a very difficult time to be making these kind of decisions. We're seeing sort of a settling of our incidence rates, our daily new number of cases in the 40 to 50 per 100,000. So that means over 500 new cases a day. That's very different than places like Denmark or other places that reopened schools and had really no problems. So we see a much higher rate of prevalence of patients who have disease right now. And the other concerning thing is that we have a lot of kids who are testing positive. Over the last week or so, we've really had the highest prevalence of children with disease that we've seen so far. That incidence rate's gone up pretty much every day for kids. Now, there's kind of 2 parts of the story. The good news is most of those kids are not sick. We've really seen very few kids get sick from this virus. That's been true worldwide, and we're thankful for that. Now, having said that, that does not mean that every kid will do well, and we do have kids who get very sick. There's an immune condition that some of them get that's very serious and can be fatal. Given the rates that we're seeing, we would not be surprised if we started to see some of those cases in the area. The other part of this story, too, is spread from a kid to the parents. We don't see that too much. We think it probably goes the other way more often, parents to kids. But again, the more we get increase that denominator, the more we increase the number of kids who have virus, the more likely that is to happen. And the last thing I wanted to say about schools too, we have to think about is not just our children, but also the workforce and the teachers. If we see over 15% prevalence in this community right now, almost by definition, we're going to have a couple of teachers in every school. They're going to test positive, and I think we still have a lot to figure out in terms of what happens when we have a positive test at the school, in a classroom. Do we isolate? Do we not isolate? Do we quarantine? These are just all really difficult decisions we have to contend with over the next month or so.
Dr. Wilson, we're going to have to run. It's always great to talk with you. You always shed some new light on this awful situation. We give our best to all you guys over at the TGH and all the hospitals.
Thank you.
Keep fighting the good fight for us. We love you very much, okay? Take care.
Thank you. We're taking care of patients safely, and we're still a safe place to be.
Good. Thank you. Bye-bye.
Take care.